Hi, I'm Dr. LaBelle. Today we're going to be discussing shoulder pain, shoulder dysfunction. When we're talking the shoulder, we're really talking the shoulder cap right here. A lot of my patients talk about this as being the shoulder. Really, this is some of the shoulder blade musculature. Shoulder pain basically comes on as we age or with repetitive usage. A lot of people will develop shoulder pain with using their arms extended above their head for prolonged periods, or any type of throwing athlete, or somebody playing tennis, or even people who have jobs that are very shoulder dependent, such as carpenters or plumbers or electricians, people who are twisting a lot. What invariably happens in shoulder pain is we develop a tendinitis. What comes along with that tendinitis is a bursitis. The bursitis and tendinitis typically cause pain when the patient elevates their shoulder in this sort of a region. They would get a sharp pain into here. As well, when you get a tendinitis, your strength starts to become compromised significantly, and lifting a milk jug or lifting your tools will start to become quite impaired. The typical patient will go through a progression of different tendon disorders. They'll start with a normal tendon, and then as they use it, they'll develop a tendinitis. If that tendinitis exists long enough, and some measure is usually 4 months, if it's been there long enough, the inflammation will start to degenerate the tendons, and you can end up developing what we call a tendinosis. Tendinosis is one of the new terms in tendon therapy, and what it talks about is the tendon's actually going through a degenerative process. If the patient does develop a tendinosis and it lasts there long enough without appropriate treatment, what will eventually end up happening is the patient may have an acute fall, or one day they'll go to lift something as simple as a peanut butter jar out of the cupboard, and they'll tear their rotator cuff tendon because the initial tendon itself is quite degenerative. How we at CCSR address rotator cuff injuries is through a complex rehabilitation program that's first involved with releasing the tendons. We would potentially release the tendons with a little bit of active release type of activity that would simply start to initiate new tendon growth. We may deep friction massage the tissue. Both of those techniques are aimed at bringing blood to the tissue and causing the tissue to regenerate at an accelerated rate. Along with dealing with the different tendinitises, we very often will then move back to the core of the person, in their chest and in their shoulder blades. It's very important, as we discussed in the upper cross syndrome video, that the patient will end up slouching as time goes on, their head comes up, and this causes quite a bit of dysfunction to the shoulder blade muscles. It shortens the pec muscles, elongates the shoulder blade stabilizers, and puts the rotator cuff into a vulnerable position. If it stays there long enough, we end up getting an impingement and a tendinitis. So, as we said, initial treatment is really aimed at releasing these tissues, and then we'll move back to the core, and the core work will be involved with releasing these tissues, teaching upright posture, releasing the pectoral muscles, and subsequently strengthening the shoulder blade stabilizer so the patient is able to hold their shoulder blades back in a much more normal position.